Hello and welcome to episode 48 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is sex. You heard that correctly. Today's topic is sex and low back pain. We are going to get into the good stuff. We're going to call it like it is because let's face it, sex is an important part of everybody's life, of everyone's relationship. It is an important topic, and it does really affect a lot of people with low back pain. So it truly is an important topic, and we're going to dive into it today. If you missed episode 47, I discussed a very interesting article comparing lumbar spine fusion to rehab and the results between the two. I highly advise you to go listen to that to equip yourself with knowledge, further reinforcing the fact that surgery should absolutely be the last resort and how much you can achieve without surgery. You do not need a surgery for discogenic low back pain. There are specific circumstances where you might, but the vast majority do not. And so if you or someone you know has been talked to about a spine fusion, please go listen to episode 47. But today's topic is all about sex. Sex is a big part of everybody's relationship, right? And let's face it, it can become an uncomfortable topic for individuals with low back pain. The study I'm going to be referencing found that 84% of patients with chronic low back pain found physical intimacy to cause them additional pain. 84% of people with low back pain found physical intimacy to cause additional pain. They also found that 48 to 73% of women with low back pain reported a marked reduction in sexual activity, in sexual frequency. So, low back pain means less sex. And it's tough because I talk about this all the time. One of the reasons why low back pain is the number one disability in the world is because there is no movement that does not involve the lower back, right? If you hurt your left wrist, okay, you can avoid that. If you hurt your low back, you can't avoid that. Everything you're doing throughout the day involves the low back. Well, sex definitely involves the low back too. So it's important to be aware of these things because if one of the partners in the relationship is experiencing low back pain with sex, very often that can create an uncomfortable situation because sex is a very important part of every relationship. And if that individual feels as though they don't want to take that away from the other partner, they might sort of suppress that for the time being and not talk about it and kind of just deal with it. So there might be pressure within that. Or if they want to speak their mind and say, hey, you know what, I just don't feel like we can do this right now, then, we all know that sex is a stress reliever. So both individuals are going to have some increased stress in the relationship itself because there is not a healthy sex life occurring. And that is an important part of every relationship. I think we would all agree. But then also the stress relieving aspects of sex are not occurring either. So there's multiple variables that will cause increased stress within that individual with low back pain. And as we know, the more stressed you are, the more pain you're going to feel. And this can turn into kind of a cycle. And we definitely do not want that to happen. So, of course, first and foremost, if you are struggling with low back pain, going over the positions that we're going to discuss today, because we're just going to dive into it. We're going to talk about the best sex positions and the worst sex positions that you can be in. But of course, simply avoiding certain positions is not a solution, right? I talk about this all the time. You can't just avoid the activities that increase your low back pain. You need to find a solution. So reach out to me, shoot me a DM, shoot me an email, submit an application on my website. Let me know how I can help you because you do need to address the root of the issue. You can't just avoid. But for the time being, especially with my clients, because I do have multiple clients, both males and females, that message me throughout the program discussing these sort of obstacles. And I go over this exact paper with them because it is a real obstacle. Okay? So let's get right into it. For the sake of this article, the partners are referred to as the delivering partner and the receiving partner. It's the best way to have a proper discussion about it. Depending on the dynamics of your relationship, you might flip-flop a few things, but for the sake of the conversation, the partners will be the delivering partner and the receiving partner. So let's get right into it. For the delivering partner is the subject that we are discussing right now. Generally speaking, these individuals were put into two different categories of low back pain: flexion intolerant low back pain, which is easily the most common. These are going to be your disc-related issues, sciatica-related issues, usually flexion intolerant, and extension intolerant. Now, the three positions that they use are the most common positions. Of course, once again, depending on how exciting you are, there might be many other positions involved, but for the sake of the general population, for most of us, we're going to go with the three most common ones, three most common positions, okay, which are the quadruped position, also known as doggy style. Just going to say it like it is. It's what most of you know it as. I don't want you looking up quadruped trying to figure out what that is. The spooning position or side lying position, and missionary. Those are the three positions referenced in this study. So for the delivering individual, what they found in a flexion intolerant delivering partner, meaning that their low back at this time does not like flexing or rounding, what they found was that the side lying or spooning position tend to be the most aggravating for them. That typically put them in the most amount of flexion, tilting the hips forward, having to round a lot through the low back. That happened to be the most aggravating position for flexion intolerant delivering partners. The quadruped position happened to be the best for them. Specifically, when the receiving partner was on their elbows instead of outstretched arms. So once again, just to make this very simple and to keep the language simple, this is the doggy style position. The deliverer felt best in this position with a flexion intolerant low back issue when the receiving partner was, their torso was closer to the floor on their elbows. That happened to be the best position for them. Now, in an extension intolerant delivering partner, meaning extension or that arch of the low back, if that was the most aggravating position, then they found the spooning position to be the best, right? Because if extension hurts, then flexion's probably going to feel better, right? So they found the spooning position, which involved the most amount of flexion, to feel the best. Now, for the receiving partner, once again, we're going to discuss the flexion and extension intolerant individuals. For the receiving partner, if the receiving partner is flexion intolerant, once again, this is typically disc-related issues, sciatica-related issues. Bending forward increases your symptoms. Sitting and bending over to put your socks and shoes on increases your symptoms. Stretching your hamstring with that sciatica increases those symptoms. These are all usually signs of flexion intolerant low back pain. For the receiving partner, the best position was the quadruped position, but not resting on the elbows. Instead, with the arms fully outstretched, resting on the hands, like a typical tabletop position or like a crawling position. That was the best. And that's simply because if you're down on your elbows, you start to get a little bit of flexion through the spine or through the lower back, or at least you have more potential to. So the receiving partner with flexion intolerant low back pain felt the best in a quadruped position with the arms fully outstretched. The next best position was the spooning position. The spooning position was the second best for the individual. The worst was the missionary. Worst was missionary. They found that it involved the most amount of flexion through the lower back for the receiving partner. Now, in contrast, for extension intolerant individuals, the missionary would have been the best. Because once again, if missionary has the most amount of flexion in the spine for the receiving partner, then that would feel best for a extension intolerant individual. And it's as simple as that. In regards to the parameters that this study was conducted in, given the positions, given the types of low back pain, as you can see, it tried to condense it to be the most simple format, the most common format. These are the best sex positions for the delivering and receiving partners who both might be experiencing flexion or extension lower back pain. So I hope that you learned something from this, and I hope that you can take this information and implement it and hopefully improve your sex life a bit if this is something that you are struggling with, which once again is a very real struggle. I hope that it does help you in regards to your current intimacy and physical relationship so that you can start to get on top of things. Because for some people, every time they have sex, it's a flare-up. Every single time it's a flare-up. So if you can now avoid those flare-ups and focus more on your rehab and you're not having a setback every single time, then this is a great opportunity for you to get ahead of that rehab. Start making some solidified changes, start to get that adaptive response, and so now you can withstand more and your capacity can improve. And this is something I would love to work with you. If you are dealing with low back pain, especially flexion intolerant, and been struggling to find some help with it, let me know. Let me help you. Submit an application on my website. Or if you want a free low back guide, shoot me an email. I'll be happy to shoot you a free low back guide as well, because I want you to learn how to fix yourself. I don't want you to rely on drugs, injections, or surgery or procedures that make it so that you don't have to do any work. A solution lies in knowledge and you putting in the work. That's where the solution is. So I encourage you, do not give up. Don't simply avoid movements, avoid positions. Avoiding is not a solution, but it can be helpful while you're in the early stages of a proper rehab program. But get on a proper rehab program with someone that you trust. I have clients all over the world, and I would be honored to help. Or find someone who maybe you think would be the best fit for you. But if you enjoyed this podcast, please leave a 5-star rating and review on podcasts reviews. I believe Apple has their reviews, and Spotify is supposed to be creating some soon. So look out for those. I would appreciate those. If you're watching on YouTube, please like, comment, and subscribe. Share with a friend who's been struggling with low back pain, or particularly low back pain involved with their sex life. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.